Scottish Government to impose pay deals on nurses. Welcome to AR News. Talks between the Health Secretary and Union have ended without a new pay offer being made. The Scottish Government will now impose its existing offers, which is worth an average of 7.5%. Health Secretary Humza Yousaf met unions on Friday morning in a bid to avert industrial action. Unions representing nurse and midwives rejected the latest proposed pay deal and said they were planning strikes, with dates to be announced next month. The meeting ended at lunchtime with Mr. Yousaf saying he was prepared to meet further over the festive period. The pay increase described by the Health Secretary as the best and final offer has been accepted by the United and Unison. The deal was rejected by GMB Union, which represent NHS and Scottish Ambulance Service workers, as well as the Royal College of Nursing RCN and Royal College of Midwives RCM. The RCN, which has more than 30,000 NHS members in Scotland, said it was angry at the development after 82% of members who took part in ballot rejected the offer. The union said it was announced its dates for strikes actions in early January. Colin Pullman, RCN Scotland director, said, "Our members will be furious that our second year in the row the Scottish Government has chosen to ignore their voice. There is no doubt that our members are long overdue to pay increase for this year, but this is not the Christmas present they deserve." For the second year in a row, the Scottish Government is ignoring them and imposing what is real terms pay cut. Keir Greenaway, GMB Scotland senior organizer for public service, said the union was considering strike action. The Scottish Government's impositions of the NHS pay offers, despite being rejected by thousands of frontline healthcare staff, is an attack on workers and attempt to silence the voice of those who faced the pandemic on the front line of our health services and are now in the grips of cost of living crisis, he said. But our members will not be silenced. They have spoken loudly and clearly that the offer is not good enough. Our members will consider their next step, but the Scottish Government is forcing NHS and SAS staff onto the picket lines. Strike actions planning, he said that further talks must be meaningful and that the pay offer nursing staff leaving the profession or attack the nurses for the future. Wilma Brown from Unison, who along the Unite had accepted the last offer, told Scotland the implementation of the pay deal was fully and gratefully received and was overdue. Mr. Yousaf said he would now push on with the Action for Change deal, which will see wages rise by an average of 7.5%, with those on the lowest pay packages seeing an increase of 11.3%. The Health Secretary told Scotland he did not think strikes were inevitable. In those trade unions that have rejected the deals said they were committed to continued meaningful dialogues, as I am and as has been the hallmark of this entire discussion, he said. The latest headline from the Scotland: read more stories on Scottish politics. I don't believe strikes inevitable and I will do everything I can try to avert strike actions. But what I have got to be upfront and honest about this, what we don't have any more money for this pay deal. He said the government would like to continue talks over non-pay elements of the deal. In a statement released after the meeting with unions, Mr. Yousaf said, given that the majority of unions representing the majority of unicized agenda for change staff have expected the pay deal, we will now move to implement this record pay deal. We believe it is a right to get additional money into the pay packet of NHS staff in the midst of the cost of living crisis. NHS staff need the certainty of the uplift pay in the financial year, and I can only do this by implementing the deal now. He added, this deal is the biggest since deregulation, represents an investment of over £500 million and ensures our hard-working NHS staff remains the best paid in the UK. The RCN had asked for a pay increase for at least 5% above inflation, which is currently 10.7%. The government pay deal was also rejected by 65% of midwives who voted in RCM ballot. The union, which has about 3,000 members in Scotland, said it was considering industrial actions. Scottish Conservative health spokesperson Dr. Sandesh Gulhay said this is a deeply worrying development which points to a complete breakdown in trust between the nursing unions and Hamza Yusuf. He added it's a time for Nicola Sturgeon to immediately restart negotiations herself with the union to prevent those potentially catastrophic strikes going ahead. Scottish Labour called Mr. Yusuf to resign. Health spokesperson Jackie Bailey said, I asked Hamza Yusuf yesterday whether he would refrain from imposing a pay settlement on the NHS and he failed to answer. We now know why. It is clear that this plan was to impose his rejected pay deal all along. Scottish Liberal Democrat leader Alex Cole Hamilton said this imposition by SNP Green government is an insult to the democracy and all those staffs who took the decision together to reject it. Nurses have gone above and beyond in recent years to keep all of us safe. They need a proper pay agreement, better working conditions, and safe staffing levels. Thank you.